Welcome to the Explainer. If you've ever had a seriously bad knee, it can feel like all roads lead to one destination, a total knee replacement. But what if there's another way, a way to fix the problem without replacing the whole joint? Well, today we're diving into a really clever surgical technique called osteotomy, and we're using a fantastic review from the Chinese Journal of Tissue Engineering Research to guide us.
So here's how we're going to break it down. First, we'll get to the heart of the problem with worn-out knees. Then we'll explore the brilliant idea of realigning the joint. After that, we'll take a tour of the different surgical techniques, weigh the pros and cons, and finally, take a look at where this is all headed, a future that's all about personalization.
Okay, first things first. Before we can even talk about the solution, we really need to understand what's actually going wrong inside a painful, worn-out knee. It's a bit more complicated than you might think.
And this question, this is the whole game changer. Instead of just seeing a worn-out joint as something to be thrown away and replaced, this entire approach asks a much smarter question. What if we could fix the underlying mechanics and save the knee you were born with?
So the official medical term for this problem is knee osteoarthritis. Essentially, it's a disease where the cartilage, that's the smooth, slippery cushion inside your joint, starts to break down. That leads to pain, stiffness, even bone spurs. But here's the crucial part. If your leg has even a slight misalignment, your body weight isn't distributed evenly. It all gets focused on one tiny spot, wearing that cartilage down way, way faster.
So, if a wonky alignment is a huge part of the problem, well, the solution starts to sound kind of obvious, doesn't it? That brings us to section 2, fixing the alignment.
Honestly, the best analogy for this is the one you see right here. It's just perfect. If the tires on your car are wearing out unevenly on one side, you don't just scrap the car, right? No, you get an alignment. This is the exact same idea. Surgeons correct the leg's alignment to shift your body weight off of that damaged area and onto the healthy cartilage that's still there. It's like giving the knee a whole new lease on life.
Now, the official name for this procedure is a peri-knee osteotomy. It sounds super complex, I know, but let's just break it down. Osteo means bone, and tomy means to cut. That's literally it. Surgeons make a very precise, carefully planned cut in either the shin bone or the thigh bone to change the angle, which rebalances the whole knee joint. So what's the end game here? Well, there are 3 main goals. First, and most obviously, you fix the alignment. You fix the mechanics. That directly leads to the second goal, which is to take the pressure off that painful, worn-down part of the joint. And the ultimate prize, the real reason you do this, is to preserve the patient's own natural knee, hopefully delaying or maybe even avoiding a total knee replacement altogether.
Okay, so how do surgeons actually pull this off? Well, it's not just one single operation. It's much more like a toolkit with a bunch of different approaches for different situations. Let's take a quick tour.
And this just shows you how versatile this whole concept is. This is absolutely not a one-size-fits-all surgery. Depending on a person's unique anatomy, the surgeon might make the correction on the femur, the thigh bone, or the tibia, the shin bone. Sometimes they even need to adjust both. It's all about finding the exact source of the misalignment and fixing it right there.
Now, because surgeons have this whole toolkit, they have to make choices, and those choices come with trade-offs. So let's look at the evidence and compare some of the most common techniques.
This is a classic example of the kind of decision-making involved. You have the opening wedge technique where a gap is created and then filled. The huge advantage, no change in leg length. The potential downside, healing can be a little slower. Then you have the closing wedge, where a small wedge of bone is actually removed. This often heals faster, which is great, but it does slightly shorten the leg and comes with its own set of risks. There's no single right answer. It's about what's best for the patient.
But the big question is, does this really work long-term? We'll get a load of this number from the research. 91.9%. That is the 10-year survival rate for a specific type of osteotomy. In other words, more than 9 out of 10 patients still had their own knee a full decade later. That's a massive success.
This table just lays out the options so clearly. You can see the trade-offs at a glance. That first one, a type of high tibial osteotomy, or HTO, offers precise correction and has that amazing long-term survival rate we just talked about. The next one, a proximal fibular osteotomy, is much less invasive, which means a faster recovery and quick pain relief. And for the really complex cases, a double-level osteotomy lets surgeons fix alignment issues in both bones at once. It's all about picking the right tool for the job.
And all of this, all these different techniques and choices, it's all pointing in one clear direction. The evolution of this surgery isn't just about creating new tools, it's about moving toward a future of completely personalized treatment.
And you don't have to take my word for it. The research paper says it perfectly. We're talking about developing personalized plans for every patient. I mean, just think about the technology involved. Using 3D printing to create custom surgical guides that fit a patient's bone perfectly, or using computer navigation to map out the ideal correction before a single incision is ever made. This is how you make surgery incredibly precise and incredibly safe.
So let's just boil it all down. What are the key things to take away? First, osteotomy isn't just a pain relief band-aid. It's a fundamental fix for the knee's mechanics. Second, we've seen the proof that it's a fantastic way to keep your own knee for longer. And finally, the really exciting part is that the future of this is all about personalization, crafting a unique surgical plan for every single person.
Which leaves us with one last big idea to think about. As these knee-preserving techniques get more and more advanced, more precise, and more tailored to each individual, just how many people might be able to avoid a total knee replacement for good? It's a pretty amazing thought.